Alright, today we're going to be going over using our tail vein model. So with our tail vein, we can give small amounts of medication IV into our tail vein. So we have Dr. Just here today who's going to be doing a demonstration for us on how you are going to be doing this skill. So what you want to remember is that you are safest directly behind your cattle. So we're going to stand directly behind and we're going to grab our tail with our non-dominant hand and we're going to lift that tail straight up so we can see the ventral aspect of the tail. With our dominant hand, we are going to palpate more proximally towards the base of the tail, and we are feeling for two bony ridges that are running along the length of our tail and finding the space in between those vertebrae for a soft spot that we can place our needle. When we feel confident on our spot, we're going to get our needle ready. Remember, always being safe with our sharps. And we are going to place our needle perpendicular to the skin. And then we are going to aspirate first to make sure that we have, in fact, blood coming from our vessel, and then we're going to smoothly inject our medication. Once all of our medication is injected, we're going to smoothly remove our needle. Need multiple needle pokes. You want to start more distally on the tail and then work your way proximally. Next, we're going to be showing you tail vein phlebotomy. So obviously you can use a needle and syringe like we showed in our injection, but this time we're going to use our vacutainer system. And we did take off that rubber sleeve that is in the case so that we can immediately see if we are in our vessel. So just like before, we are safest behind our cattle, and we're going to pick up our tail and find our spot with our dominant hand. Once we feel good about where our needle is going to be placed, again, we are perpendicular to our skin, and we can clearly see that we are in our vessel. Remember that in a live cow that you would have dark red venous blood if you were in your vein, and then it would be bright red if you were in your artery. Now that we've got our tube fully filled, we're going to go ahead and remove our tube first and then remove our vacutainer needle